Hello and welcome to our presentation called The Endorsement of Artificial Intelligence Guidelines Across Leading Geriatric Journals, a Cross-Sectional Analysis. My name is Beck Wakefield, and this presentation has been co-authored by Daniel Waller, Con Nguyen, Rachel Hazlitt, Joanna George, Patrick Crotty, Andrew Tran, Alec Young, Dr. Alicia Ito Ford, and Dr. Matt Vassar. This presentation primarily focuses on the use of AI in the field of geriatrics and gerontology. It's important to note that the population of elderly people, which is classified as people over the age of 65, is growing rapidly, and it's predicted that the geriatric population will double in size by the year 2040. Similarly, it is imperative to note that the use of AI is being used more and more in different fields of research, geriatrics included. So AI is useful in this field for understanding mortality rates, making care plans for senior citizens, and can improve clinical decisions. However, what we are interested in talking about today, what the aim of this study was to do, is to look at the leading geriatric journals, specifically the top 100 journals in this field, and look at what their reporting guidelines are on AI use. The objective of this study is to look at those top 100 journals and then to reconvey the data that we extracted from them. The way we went about doing this was we did a cross-sectional study looking at the top 100 journals from 2023. We determined these journals by SCI-MAGO ratings or SCI-MAGO journal ratings, and by an H-index and SJR. We went about collecting this data using two authors, collecting this data independently, and then reporting them down to provide the data that we have. The characteristics or the descriptive data that we collected on specifically from each of these journals was AI-generated contents, such as images or manuscript writing. We reported authorship and whether these journals allowed for authorship use by AI or authorship consideration by AI and AI-assisted writing. The results that we found can be seen in the summary results here. Notably, 28% of journals especially addressed AI usage in their instructions, of which most prohibited. Most journals mandated AI disclosure. 37% of journals sanctioned content generation, while 74% of journals sanctioned AI-generated images. Higher impact journals had more descriptive AI instructions, and ultimately we can conclude we're reaching our inevitable doom. I'm just kidding. Probably not. But these results are also conveyed visually in our graphs that we have presented here and in the table and in table 1.1. There's more tables at the QR code at the bottom right corner of this presentation. What we came to a conclusion as a result of doing this study is that AI can be helpful in the area of geriatric or gerontology research. However, it still proves to be unreliable, and the top 100 journals in the geriatrics field are inconsistent with which following AI reporting guidelines and what they can allow based on the descriptive data collective data points that we had mined for. Most of these failed the ICMJE guidelines, and in the future it would be of interest to come back to this study and see how these same top 100 journals have changed their reporting guidelines to see if there's been any improvement in consistency and what they allow for. Thank you for your time.